everyone! Welcome back to my channel and welcome to all new viewers. My name is Olka and I'm a UK-based vet, and today I'd like to talk to you about post-operative care in dogs and cats. Before I get to it, please don't forget to like, subscribe and ring that bell if you enjoy my content. This allows me to keep this channel going. I aim to release a video every week. I also have an Instagram account where I post daily, so go and check it out. Without further delay, let's dive into the topic of this week's video then. The vast majority of dogs and cats will at some point need some form of operation or surgical intervention. This could be a routine elective procedure, like neutering, spaying or castrating, or a non-routine, non-elective procedure, such as foreign body removal or tumor excision, or maybe repair of a fracture or stitch up of a traumatic wound. Sometimes it happens when you least expect it and have absolutely no control over it. What certainly needs to happen after every surgery is you providing some kind of post-operative care to your pet. There are a lot of factors affecting the type of care required, but there are also some basic common guidelines. Firstly, always follow your vet's advice. Your vet will give you specific instructions tailored to your pet, the type of surgery they've had, and their individual needs. After an operation, you will be booked a discharge appointment with a vet or a veterinary nurse to discuss your dog's or cat's post-op care, what to expect, and what you should be doing to help them recover as quickly as possible. Always listen to them carefully and follow their advice. If you think you might struggle remembering all the instructions, ask for a written form. Printouts are typically available. It's always okay to ask additional questions if you have them. It might be a good idea for you to write them down so you don't forget about anything during the appointment. After you collect your pet from the veterinary practice, you should get your pet home as soon as possible to avoid unnecessary stress. Try to make the journey home as calm as possible. Don't let your dog jump into the car if possible. Try to leave them in and safely secure them for the journey home. This is not always the case, but commonly, when you get home, you might notice that your pet is quiet and sleepy. This is absolutely normal after anesthetic and usually wears off within 24 hours. Sometimes it can take a little longer. During this time, it's a good idea to keep cats indoors and only take dogs out for short walks on the lead to go to the toilet until you are sure they are back to their normal selves. Provide them with an environment as calm and as relaxed as possible, so your pet doesn't get any more anxious and unsettled. Ideally, make a secluded, warm room with dim lights accessible. If you have other pets or children, it can be a good idea to keep them away from your pet while they are recovering. Some medications used for sedation and general anesthesia can make your pet constipated, so do not be alarmed if your dog or cat doesn't pass poop for a couple of days. However, if you see them straining or trying to go to the toilet without success, you should contact your vet for advice. After the operation, you might notice that on certain areas of your pet's body, there's fur missing. We have to shave the areas which we operate on to avoid contamination. Another area which could possibly be shaved are legs. We do it when we need to get blood samples or place IV catheters, also to make the area as clean as possible. Don't worry if your pet has had to have an area shaved for their operation. Their fur will usually grow back in a few weeks to a few months. You may also notice that they have a bit of a cough. This can happen due to intubation. We place endotracheal tubes which go inside windpipes during general anesthesia to provide your pet with oxygen and anesthetic gas. The tube sometimes rubs against upper airways, resulting in temporary irritation and inflammation. Normally, cough caused by this will stop on its own within a few days. Rarely, anti-inflammatory medications might be needed. So, how do you care for your pet after they had a surgery? Usually, unless there is a specific reason not to, depending on the operation and your vet's advice, they are allowed a little food once they are awake and are steady on their feet. You can feed a small amount of food shortly after returning home. There is no reason not to give your dog or a cat their normal food, but you could consider getting a special so-called recovery diet. Diets like these have increased calories, protein and fat, meaning even if your pet eats less, they still get the nutrients they need. They are also made to be particularly tasty and attractive to your pet, of course to encourage them to eat. As for water, you should provide them with free access to drinking water at all times. What about wound care? A sutured wound should be left dry for at least 2 to 3 days. Any dried blood or discharge around the wound can be gently cleaned off after that time. Use lukewarm water and avoid any soaps or shampoos not recommended by your vet. Ideally, you should check the wound twice a day unless it's covered by a bandage or a dressing, to check for any loosening of the stitches or discharge. Try and inspect the wound and surrounding areas for any swellings or redness. Any pain noticed after applying gentle pressure around the wound might indicate developing infection. Any self-trauma should be dealt with as soon as you notice it, either using an e-collar, also known as a cone of shame, or by applying a bandage or a dressing. This should really be done by your vet though. You can also get special recovery vests and jackets, which protect surgical wounds. Lots of pets aren't fans of stiff plastic e-collars, but nowadays you can get a variety of softer, comfier versions. Even if your vet practice doesn't stock them, you can get them online. It is crucial that they, or any other pets you have, don't lick or bite these areas, as this could result in wound breakdown and infection. Dressings should be checked at least twice a day to make sure they don't slip, get dirty or wet. If a bandage was put on one of the legs and toes are uncovered, check them for signs of swelling or poor circulation. If they feel swollen or colder than other feet, or a lameness of a bandaged limb develops or worsens, the dog should be seen by your vet at the earliest opportunity. Bandage disease such as pressure sores or hypoxic tissue damage can lead to very serious problems. In rare cases, if not treated quickly, your pet could even lose a digit or a limb. What about exercise? Regardless of the procedure, exercise should be kept to a minimum for the first 24 to 48 hours following anesthesia. After the first couple of days following most routine and minor operations, you can gradually start increasing the amount of exercise. For the first 10 to 14 days or until stitches are removed, I tend to recommend only gentle walks on a lead. There are of course some operations after which exercise needs to be restricted for much longer, and some animals require cage rest. These would normally involve orthopedic problems or very ill patients. Always follow your vet's recommendations on this. What about medications your pet has been prescribed? Follow the instructions given by your vet, of course, like when they should be started and how often they should be given. Some medications have to be given with food, some on an empty stomach. Before you leave the practice, make sure you know what formulation it's in, whether it's syrup, tablets, or maybe some other form, and how to give it. Depending on the type of surgery your dog or cat has gone through, you can observe different levels of pain. Restlessness and vocalization may be signs of pain, but are sometimes observed as post-anesthetic phenomena unrelated to the operation itself, suggesting that there may be a kind of post-anesthetic hangover response. If you are worried that your pet might be in pain, contact your vet. Remember to see your vet for post-operation checkups. These would usually be scheduled before your pet goes home. During these appointments, we make sure that there are no complications present as a result either of the anesthetic or the surgical procedure itself. Before your appointment, try and monitor your dog or cat to be able to answer some questions about the urine and poop output for both quantity and quality, their appetite and water intake. Note anything unusual that might have happened between the surgery and the first post-operation check. You and your pet will likely have gone through a lot with their surgery. Yours and their emotional responses, cost of the procedure, logistics and physical recovery, and more. The way you care for and nurse your pet in their post-operative period has a massive impact on their recovery. Make sure you discuss their specific post-op recovery instructions with your vet and follow those instructions. And if you have any questions or concerns, don't hesitate to reach out for advice from your veterinary practice. And lastly, Thank you for watching. I hope you liked my video. Like, subscribe, and I hope I'll see you here again soon. Bye!